I'm Hyun Kim from Gangnam Nanori Hospital, South Korea. Today, my presentation title is that Comparative Interventional Cohort Study, Clinical and Computer Tomographic Fusion and Substance Evaluation for Uniportal Endoscopic Posterolateral Approach TLIP versus Open TLIP. This study has been accepted by the Global Spine Journal. The current implemented endoscopic transforaminal lumbar fusion is divided into transforaminal Campbell's approach and posterolateral approach. In this study, we aimed to perform comparative cohort study to evaluate the fusion rate, substance rate, and clinical outcomes of uniportal full endoscopic TLIP in comparison to microscopic minimally invasive TLIP for single-level lumbar fusion. This study was conducted in patients with a single-level open TLIP and uniportal full endoscope TLIP from 2018 to 2020. Both ODI and McNabb criteria were evaluated. A total of 33 uniportal full endoscope TLIP and 22 open TLIP were included in this study. And follow patients with an average of 1 year or longer were included. Patients with grade 2 and below spondylolisthesis, spinal stenosis with and without instability, adjacent segment disease, and recurrent disc herniation were included in this inclusion criteria. This study evaluated the fusion grade based on CT performed immediately after surgery, 6 months and 1 year. In addition to the already well-known Breedwell classification, we use the novel classification of 4 stages of Kim's classification based on the CT follow-up. Kim's classification grade is divided into stage 1 endoplate preserve stage, stage 2 endoplate opening stage, and stage 3 bilateral sclerosis stage, and stage 4 fusion bridge formation stage. In addition, the substance grade was evaluated using CT, and the grade were classified from grade 1 to grade 4 according to the degree of substance. The first step of uniportal full endoscopic posterolateral transforaminal lumbar interval fusion is the process of resection of SAP. And this process can be divided into medial to lateral approach and lateral to medial approach. The second course is the disc preparation course, which is the most important course in the uniportal full endoscopic TLIP. This is because effective disc height restoration and high fusion rate can be obtained through this process. The most important part of this process is adhesive disc drilling and endoplate denudation. The next process is the inserting the cage, and this process can be effectively and safely inserted using the Harrison cage glider that has bilateral nerve root protection that I developed. The result of this study shows that uniportal full endoscopic TLIP compared to open TLIP is Bass, ODI, McNabb's criteria showed similar results, but the 1 year Breedwell fusion grade was low at 1.24 than 1.73. The 1 year Kim's fusion stage was higher at 3.7 than 3.14. The 1 year Kim's substance grade was lower at 0.48 than 1.05. Among them, 1 year Breedwell fusion grade and Kim's fusion stage were statistically significant. Uniportal full endoscopic TLIP has several advantages compared to open TLIP. The first advantage is that the fusion rate is high and the fusion process is fast. The factors involved are probably related to endoplate denudation, 3D printed cage, and the DBM block. The second advantage is that the disc height restoration is very, very good. The third advantage is that it can be seen that since the disc height restoration is well done, focal segmental correction can also be effectively performed. Because of that, Some of adult degenerative scoliosis can be effectively corrected through several advantages of posterolateral unipolar full endoscopic clip. This patient was a 62-year-old male patient who complained of severe right lower extremity pain. The pain was remarkably improved through unipolar full endoscopic clip, and the fusion was very successful at 1 year follow-up. This patient was a 57-year-old male patient who complained of severe right lower extremity pain. The pain was remarkably improved through unipolar full endoscopic clip, and the fusion was very successful at 1 year follow-up. And it can be confirmed that paraspinal muscle atrophy, including psoas muscle, has sufficiently recovered. In conclusion, application of unipolar endoscopic posterolateral lumbar intervallar fusion achieved comparable clinical outcomes and better fusion with less substance than microscopic minimally invasive transforaminal lumbar intervallar fusion in midterm evaluation in our cohort of patients. Thank you so much for your kind attention.